we just finished gynecomastia case on a gentleman who is 38 years old, young. He exercises all the time, but was not able to get rid of this gynecomastia problem that he was facing. He felt like his chest was rounded up and the bottom and looked like more breast. He was very particular in not taking too much volume out of his chest because he has worked really hard to get this nice masculine chest. And part of the surgery, we always have to do a little bit of liposuction to clean out the lateral borders of the pec muscle and release the gland in a way that we can excise it through a small little opening. So we did a little bit of liposuction. We removed this gland, which is, you can see, and this is rounded up, and this gland, the right and left gland, to be able to create nice, beautiful harmony for his chest. Thank you for joining us.